Well, welcome back. COVID-19 cases are climbing countrywide as the third wave continues to batter South Africa. President Cyril Ramaphosa has announced fresh restrictions in response to this, but this may not be enough to stop the country's healthcare system and hospitals from collapsing under increased admissions. Professor Adrian Purin from the National Institute for Communicable Diseases joins me now live. Prof, thanks for your time. We appreciate it. I'll start with the President's address and the decisions taken tonight to actually curb the spread of COVID-19. Is it enough?
Well, it is a start. It is part of the risk adjustment that the country has to adopt. I think it has done that in the second resurgence. Just as a note, as you know, the NIC, together with the various members of a modelling consortium, did indicate that, or paint a scenario that Gauteng would be the worst off. But in fact, other provinces may not experience the same extent. So I think it's going to be a nuanced way in which this particular pandemic will, or this particular resurgence will actually work out. But obviously, Gauteng is corresponding to what was actually painted in those scenarios. So I think the option or the use of a level 3 readjusted level, I think, was probably the most appropriate in terms of the circumstances, in particular trying to focus on Gauteng, but also in terms of trying to stave off events in the other provinces as well.
And staying with Gauteng, the President announcing that nationally even that private sector hospitals are near capacity. Are you concerned at all, and I've asked you this before, are you concerned with these new numbers about the hospitals being able to handle the number of people coming in there for admission?
Yeah, so it is critical that we keep a tab on these particular numbers. And as I've indicated, there's more if you like, real-time monitoring in order for us to really keep a track of the actual case numbers, and that would actually inform whether or not we're going to go reach our capacity or overreach the capacity. Therefore, I think provinces are critically aware of these particular model projections and will have to take into account that perhaps if their field hospitals have been mothballed, in fact, they may have to take them out, particularly in Gauteng.
And let's talk about the new infections, just over 8,000 we've seen.
Yes, so we're on a trajectory which is what I think was really predicted in a way in terms of the modelling. So yes, it's going to really have a trajectory which is going to be more marked significantly than compared to the second resurgence. So I think we're in for a tough time in terms, and therefore I think the level 3 readjustment is really critical, because I think it re-emphasizes the need for the so-called non-pharmaceutical interventions and reducing the contacts, in particular around the numbers and types of events, in order to try and really stave off transmissions as is best possible.
Prof, we're seeing 208 people dying, recorded deaths, that is, in the past 24-hour cycle. Is the daily death rate something to be worried about? Is it higher than previous?
I can't remember the exact numbers, but they probably are approaching, or at least in terms of the past few weeks, certainly increasing. But can't recall specifically on the actual previous numbers. I apologize for that.
Yeah, no, that's fine. And then, Prof, just in terms of the vaccine rollout, of course, the NICD works very closely with government when it comes to communicable diseases. What's your view on the rollout? The President seems to be satisfied with the daily inoculations taking place in the country. But the reality is that there are many other African countries that have been able to inoculate more people than South Africa. Do you have any concerns in that regard?
Well, I think the government has expressed its concern. In fact, the previous incumbent health minister did indicate that it was slow, and I think there have been a series of unfortunate events around that. However, I think tonight the President again did stress critically that, in fact, we need larger scale rollout. In fact, he indicated that, in fact, it has to go even higher than what we currently are predicting. So I think there is a concern, and especially in the fact that we really need to ensure that specific age groups, age categories, with and without comorbidities, need to be vaccinated. I think one of the pluses possibly for us that we need not to forget is, in fact, that there are a significant proportion of the healthcare workers that actually have been vaccinated. And again, the President did announce that he attributes the lower levels of infections, in fact, in the healthcare working group as a result of vaccine. So I think there's a glimmer of hope there. I think that we should hold on to, and the hope that the programs really reach the targets of 120, 130,000 per day in order to reach those particular targets in very good time, in order for us to really minimize the types of waves that we are certainly seeing in Gauteng. I'm hoping in the other provinces that we don't see something similar based on the scenario plannings that we have seen.
Do you have any concerns about the large numbers in Gauteng and people still being allowed to travel across provinces?
Yes, so again, I think that there's no real expression around travel, but of course I think that's an important consideration. If there is constant mobility that is certainly attributed to or contributing to those particular cases, then it's something one would have to consider. But I think for the moment, perhaps that level of mobility is not contributing as much as, for example, other events in terms of congregant events, mass super spreader events that are certainly contributing to what we are currently seeing.
All right, thank you so much for your time and your insight. We do appreciate it. That was Professor Adrian Purin from the National Institute for Communicable Diseases.